Okay. We are live.
Okay, so good afternoon from Brazil to everybody that's not watching the World Cup. We are now on our Rural Family Medicine Café, the 32 edition. It's awesome. We are almost on the way for our 3 years birthday that we can keep going and continuing sharing our views, information, and learning more about different topics in rural. My name is Mara Flores. I'm a rural doctor in south of Brazil, and I'm quite excited to share a little bit about this dam, which is really interesting and really important. That's mental health. And I do feel that rural health has a lot of things to that are really different from urban settings, and that we need to be aware and prepared to deal. So hello all, and we are on Facebook, so if you have anything you can message on Facebook, and we are also on the hashtag Rural Café, so we can try to bring the discussions to here now. As soon as people comment, we can bring it. Okay, so maybe I ask for Andressa to start introducing herself.
Hey everyone, my name is Andressa. I'm a medical student from Brazil. I study in the south of Brazil, and I'm very excited to learn more about this topic because mental health, just as another chronic diseases like hypertension or diabetes, are really important subjects for us to learn and to know how to deal, manage, and to support people who are experiencing a time of an issue on mental health. So, as a student, I would like to learn more and bring some experiences in clinics of our clinics. Okay.
Thank you, Andressa. Chirac, I'm not sure if I pronounced it correctly, but I think you're...
Hello. Am I audible? Hello, Mayara. Yeah, it's correct. I'm Chirag from India, and I'm excited for the Rural Cafe. I felt sorry I missed that Rural Cafe session in the WRHC Delhi. So I'm excited about this one.
Thank you. I'm happy that you're here. And just go to Anna.
Hi, my name is Ana Julia. I'm also a medical student from Brazil, but I'm from the middle of Brazil. And this topic for me is really important because when I did my a rural practice, I noticed that a lot of patients in rural areas has mental disease, and this is important for us to know about. So it's a pleasure to be with you today.
Wonderful. So it's a pleasure to be with all of you. And one of the things that we need to be aware, it's the difference between mental health in rural areas and urban areas. I just want to ask if anyone of you have any experience that you want to share, anything that you live it that's different from the rural perspective or from the, your point of view. So we can try to start by that. Anyone wants to share anything?
Well, when I went to Cunha Porã and did my placement with you, one of the things that most caught my attention was that I thought that the life in rural areas was like wonderful. People lived in quiet places with the sound of birds, and they don't have problems. But what I saw in practice was that the life in rural areas is more difficult than in urban places sometimes because for example, in Cunha Porã, they have to deal with tobacco production in some properties, and all the amount of money that people earn in a year is with the production that they do in all the year. So if the weather or something don't contribute to them, they don't earn any amount of money to pay the bills, and was one of the things that the agricultors most talked with me when I went to their properties and said that this is really difficult, and for us they have a lot of worries because of this, and I didn't expect this on practice.
Any, Andressa, I thought that you want to share something as well.
Yes, actually, it was something quite similar to what Anna said, because here, where I live, we have place that is in a rural area, and there is an interesting fact about this neighborhood. That is, if neighborhood was a city or a town, if it was considered a town, this place would have the greatest number of suicide of Brazil. So it's a really interesting thing to know that in rural places, people are having mental issues, and we need to know how to manage it. We even need to know that they exist in that places. That people in rural areas are killing themselves, that they are having some issues with alcohol, and many times they are having mental diseases not diagnosed, and here in the south of Brazil is really common mental issues, but maybe because they are diagnosed more, but the problem is there. Sometimes we don't know that it is there, but we have to know. So it's my talk.
Yeah, it's interesting that there are urban versus rural disparities in suicide mortality. There are some studies that is coming up to show that, and I thought depression is higher in rural areas, and what we do is we romanticize, we put the rural life in a quiet place, like Anna said, and then that's wonderful and awesome, which is as well as being a rural doctor, but it is stressful. At 5 a.m., my patients need to wake up to take the milk of the cows and to deal with the animals and to, go ahead with the day-by-day work, which is a huge amount. If around 5 p.m. they need to repeat a lot of things, they need to feed the animals and everything. And like, for instance, this week, it's 0 degree or 1 degree Celsius degrees here. So, and the animals need to be feeded. They need to get the milk out, and they all the time are dealing a lot with and the economical issues and as a health determinant as well. So being a rural, unfortunately, now in Brazil, it puts you in a higher risk to develop a mental disease. So that's a huge thing for us to think about. Maybe can you bring a little bit of perspective of India, Chirag?
Yeah, sure. I would like to add that I get to have my rural postings in the next semester, so I would have more valid experience in the next coming semester. But what I have from now is that in rural areas, there is also in our rural areas where I'm working in Rajasthan, where I'm studying. It's like many. Like superstitions are also widespread, and they consider like some gods, some other powers to be controlling them sometimes. So what I have experienced in my OPDs is that some patients are coming with like schizophrenic and these kind of symptoms, and they believe that some other powers are controlling, external powers are controlling them, like these. And we have a nearby village in some other district that is defamed as known to be as widow's village, because in that village mining is the main occupation of all the people. Mining is the main occupation, and there is silica explosion, and because of all that they suffer from diseases like silicosis, and they have an average lifespan of about 30 to 40. They usually die in early 30s. And when they come to doctors ask them about the conditions, working conditions of the mining, but they are very ignorant, and they say that this is their only source of livelihood, and they have to work in that. And when they die, their children will work in that. So that's
Yeah, sounds terrible, I stayed in I visited some centers in Kolenchari, in Kochi, when I was in India, and a lot of times mental health is still being a taboo. The access to the medications and treatment and being followed by a psychologist still being like less than in Brazil as well. And I do think that the rural people are more exposed. Like, also another thing that I want to add, that the rural people is more exposed to the pesticides. So this is really I do not have that knowledge to say the straight relationship, like by my patients' exposure to pesticides. They do not use the equipment correctly, so they are more exposed, and then they have more. I do feel that they have more mental disease. We are trying to run some studies, but we still like on the way of that, but I do feel that it's a major health determinant and mental health determinant to being exposed to pesticides. Another thing that I want to bring is that people that live in rural areas do usually use more alcohol, has less chance to stop to smoking, and they are, even if we do feel that on the urban areas they have more, it's easier to get more products for like smoke and everything. In rural it's much more intense, I do feel, and the access to health is low. So unfortunately, and I do feel also that we are not well prepared to deal with mental health. On the beginning when I was starting to work and until now, every week I have a suicide, a person with suicide. They were trying to get to hurt themselves all the time, and at the first time I was quite scared to deal with that, and what's the next step, what should I do. And even if I knew it by the practice, like by the books, I didn't know it living and on practice, which is quite different. But I just want to ask, is Marcela around?
Marcela said that her audio is bad because the connection. I don't know if she's listening.
Okay. So hopefully when she comes, she let us know if she's able to talk. So
Yes.
another thing that I want to ask you from your different backgrounds is, what I do feel is that the rural people has less things to do, like less places to go. There is no theater in rural, or like what's the things that people do to get. There is also other kinds of plays, but people usually what they do because having this free time to walk, to go to a park, is also part of what is mental health. So what do those people do in your rural areas, or what you have experienced as a student or have saw? Who wants to start? Andressa.
Well, here in that neighborhood that I talked earlier, they they found this need of promoting health because of that situation of lots of suicide and mental diseases. And so the basic unit of health there with the Ministry of Health here, they created a group of sing, a group of like a choral, you know, and families of people who have suicide, that who have killed themselves, they just gather together and they have such classes of vocal, and this group it's started to grow, and they present themselves in some conferences and some events, and it's really nice. In this neighborhood, they have place, a big place when they do typical foods once a month, and they call all the population of the neighborhood, and they talk about health. In some community agents go there to and some dentistry, education, and they started to do these things to reduce the isolation of people because rural it's quite far from the theater, the other things in the city. Even if it is in the city, but this neighborhood is more far. So it's things they try to do to people.
Sounds wonderful. Like rural and try to get together. And Anna or Chirag, do you have any experience of what does people do in rural, like for leisure?
Well,
I have a little
here
bit
in
of
my
that.
Wait, one of you. Okay,
Uh,
Chirag. Yeah.
yeah. What I know a little bit I have experienced is just that in our scenario, the suicide rate among farmers is high, and their kids or those people can go to rear their animals in the fields, and these kind of activities we don't have uh, access to high level facilities like ours in urban areas. There is huge difference among rural and urban areas in ours, although it's now rural areas are also getting a bit developed, but I don't have the real scenario. Um, and I would like to add that too that there is also very much stigma attached to the mental diseases and these kind of things in India. People, although now it's a bit opening, the thing depression is becoming very common, and even celebrities are like opening up to their experiences of depression. So now a little bit of awareness is spreading, but still there is wide stigma attached to the mental problems, and people hesitate to go to medical facilities for these kind of problems. Is this like so in Brazil?
Uh, I'm not sure if Anna wants to mention anything before, and then we go to the Chirag question.
No, you can answer the question.
Okay. Yeah. Well, we do have some strategies for patients, but like what I do in my workplace, we are trying to create a group of handicraft. So then mainly women can do handicraft with other women, so they can work together and learn with themselves together. Also working a little bit with uh, local plants and teas, and then people can get more involved. But for arts as well, I do feel that still being a lack of things happening in rural areas. So like for like cinema, theater, screens, people are not used to have access to this kind of thing. So and I do feel that it's a huge loss when children cannot have contact with uh, more contact with arts or museums, or you know uh, you don't learn how to with that, or how to listen music. So that's a huge issue, that this lack of access. But it's how it is here, and maybe we should have like more a work to bring arts and contact to music and different forms of expressions in rural areas. I would love to have that for my community at least. Chirac?
Yes, this. Can I
Yeah,
can
yeah.
I comment?
Yeah.
Because this thing that you said, I have a classmate in my university that she came from a rural area in around Uberlândia, and the first time that she went to a theater was last year, I think, and she is 22 years old. I invited she to go to a dance show that we would have in Uberlândia's theater. So she said that in her city she had no access to cinemas, to theaters, to show music shows. And the first time that she went to see a movie in the cinema or to a theater was when she moved to Uberlândia to study. So this is really true in Brazil.
So I think Andressa have a question for myself. Maybe she can explain it. But isn't that awesome? That's like, but if you think that a lot of people in rural areas never have saw a doctor or a professional, imagine having access to a theater. You know, like, so we need to work a lot to fill these gaps, and uh, we depend of rural people to produce the food all the time. That uh, last week I was with a family that produced cheese, and then I was imagining if people knew all the work that for doing one piece of cheese that this family has, and all the what they are involved to do just one piece of cheese, and then people just go to the market and eat it and never think about who is producing that. So if you imagine that people do not have even access to health professionals, imagine to leisure, like of course they do create a lot of leisure that's just by the I like the choral that's Andressa was saying, like the little dancing parties that they brought the whole community, and these kind of things are also leisure, but some kind of other types of leisure like museums, arts is still being a huge gap. So what do you want to ask, Andressa? Okay, I got it. Like going for a walk or creating a space for leisure. Well, we didn't create that yet, but we do have like the NASFI, which is the nucleus of family health, which does this kind of activities and everything. So I feel that's quite interesting to see it. So we do have someone. Sartak, how are you?
Hi, Myra. Hi,
Oh,
Andressa. Well, actually, I'm really sorry I was late. Actually, there's a huge storm going on over here, and yeah, because of that, the electricity is not there as I'm in a rural area myself. So yeah, yeah. So I was a bit late, and just now the electricity came, and I thought of joining the call in midway. I'm sorry. The
And
I'm glad.
you're supposed to be sleeping because they're really late, the
Oh,
time.
yeah, it's like around 12:30. Yeah, exactly. But there's no there's a huge storm because of, I don't know, like dust storm going on right here, and it has been going on for like 2 3 days. Yeah.
Oh, I hope you're okay. No problems that you're late. Introduce
Yeah,
yourself
yeah,
for those that are watching us.
yeah. Well, hello everyone. My name is Dr. Sathak, and I'm a young doctor. I'm currently working as a medicine doctor in a rural area in Rajasthan in India. and that's all about me. And this is my second rural cafe. My first rural cafe was in New Delhi, and I was very much in love with the idea of it, and that's why I wanted to join this one. The topic of this rural cafe is also very special, mental health in rural area, and I think it's topic which is not much talked about. So I thought of joining this call. Thank you, Myra.
Thank you. So we're just commenting on what is the leisure that your patients have access, like, or that rural communities have access. So what is they play, what they do for leisure?
Oh, well, I don't know. I don't think they have a lot of activities in rural areas about these about leisure. Well, yeah, I haven't actually heard about it. So I think it's a question that I would like to know from you guys. Like, what do you guys do in your area? And yeah.
We were just sharing what Andressa mentioned about the choral, and I was saying they do in my area, but also I do feel that access to arts, museums, and this kind of stuff still being very, very more difficult in rural areas. I do feel in all the world. So maybe leisure is part of mental health. People keep all too involved with the way that they live, the way that they do the things, producing the food for the cities, that they are quite not able to have time for themselves. They need to work from Monday to Monday, 24 hours, 7 days per week, all the months of the year. I did have a patient that say to myself, you know, my dream is that my son had a chance to see the sea, because she wants that her son's work and study, so he can go and see the sea, because she would never been able to see the sea. So that's the biggest dream for her, because it's quite far away from where we are working to reach the sea. So, this kind of, they never can have vacations if you're a rural producer or a farmer, or who are in a rural area. So yeah, anyone wants to comment? Okay. I think this is a no. Okay, so I was just thinking, is there any like special research about mental health in India? Like, do you know any special research about it? Well, the thing that I want to bring is about suicide in rural areas. We were mentioned this before, but I want to bring a little bit more about that. We're still having around 10 minutes to talk. I'm not sure in India, but in Brazil, it's higher in rural areas, the suicide rate. We don't have a major study, but we have some minor studies that show that. And it's related to the production, it's related to the way that they live, and it's an urgency how to deal with that. So did you have any experience of how to deal with a suicide person, or in your work, or anything like that?
Well, actually, you're right, Myra. Obviously, there's I think, increased suicide rate in rural areas as compared to urban areas. But the thing is, generally, all the research which is carried out is for urban areas. So the suicide in rural areas tend to be remain undocumented mostly, and a larger emphasis is not laid out on the rural areas specifically. To check what is their suicide rate, because as the major of the researchers live in the urban area, So generally, the data about the rural areas is not that easily available as well. So that's also a shortcoming that we have to address. And about suicide, as you said, it's still talked of as a stigmata in India, and till now we have not been able to, catch up on that. I don't know if it's the same case in Brazil as well, where people in India people don't talk about mental health so openly as well. So that is also a thing which is a very difficult point to overcome. And generally, families are not that supportive. That's a thing which I've seen in my practice, that generally families are the first pillar of support. If you see in other countries, they help them friends and families, whereas in India it's not that much so. And if there's another point that I can add is, during my medical school years in India, actually the drug addiction is also considered a part of mental health. I'm not sure if it is the same in other countries as well, such as Brazil and others. But drug addiction, like in my state, there was a huge problem of drug addiction, and they were clubbed with mental health and psychiatric. So, although those are two different issues, but there's not a lot of generalization in the psychiatric area that should be there. Uh, and also, I would like to ask this question to guys: Is drug addiction a part of psychiatric problem in your country as well?
In Brazil, we do have. It's not a part. It depends of the size of the city. So, like in the place that I work, we deal all together with like as psychological. The and the bigger it is for that, but psychology it's I think in the risk wants to come.
Some professors of mine, they try to find some causes of this high rate of suicides in rural areas. And I remember a day that one of my professors said that maybe they have access to some more little instruments to die. For example, like pesticides or the ropes, you know. Here in Lajeado, that is the city where I live, people, it's kind of a joke. People treat these subjects just as a joke. When you go to a store to buy a rope, and the guy who's selling the just teach how to do the knot of killing. You know, I don't know how to say this. The knot that people do when they want to kill themselves with a rope. So people here, there is another thing they say, that rural areas are here. They have lots of people from German colonization, and they say that there's a genetic factor that can influence, that can contribute to this thing. They are studying this now here, this genetic component, and they say that men kill themselves in a more little way than women in the rural areas. Women used to drink medications, to use medications, and men used to use rope and more little ways?
It's a risk factor to be a man. Yeah, to have a men usually use more fatal ways to kill themselves than women. They are less. They do more attempts, but the women succeed less. One of the things that I do discuss a lot of with my health team, they were unprepared, the community workers, the way, because it's still being a taboo in Brazil as well to discuss about rural health, mental health is a huge taboo, even if a lot of people is taking pills for like fluoxetine and depression, and a lot of people take medications to sleep. They still feel that it's a taboo to talk about mental health. Some nurses try to create a group on mental health, and then there is no one that wants to participate because all are like health in mental, so they just change the name of the group, and then people is participating. So just this is just an example of how people are that how big are the taboos. But one of the things that we created like a flux for people that is in risk of suicide. So we do apply a Babel kit, which is a lot of questions about uh, for trying to get if the person is anxious or depression. It's a way to approach the person. So if the nurse or the nurse technician identify any risk factor for the person, they will have a myself. They try the policy and we will stop anything, and then we are going to try to talk with that person, and then we do have some strategies to deal with that. Sometimes we can call to our psychologist to come, or we can try to do bring the family of the person. We can try to deal find ways for dealing, because if the person is coming to the health center, he or she is seeking for help, and it couldn't be in a rush. So we try to stop and help really this person to understand what's going on and the risk of their life and how their life is important, and try to give some support. But I still feel that we are very unprepared to deal with these situations. And I don't know how was in your med schools, but if you are prepared for dealing in a very isolated setting with depression and all these things, and we always learn to send to refer to someone, but there isn't psychiatrist on my place. It's all on myself. So what do? You know? So maybe you can share a bit of your experience, Anna?
Yes, I'd like to share about the thing that Sartak, I don't know the name, that he comments, because here in rural areas around Uberlândia, it's like this that you talk. It's just the family physician to do the mental appointments, and sometimes you don't have a psychiatrist to refer. But here in the city, in Uberlândia, we have some centers. It's called CAPS, and we have two specific CAPS for drugs and alcohol addictive. So people are referred to there, and they have access to psychiatrist and psychologist type of appointments, and they they help the people to stop using drugs and alcohol without using the abstinence technique. It's just more I forgot the name, Mayara. Like when you try to decrease the damage that the drugs do with the person. I forgot the name of this technique, but they do this here in Uberlândia. So in the city, the access is quite good for this. Even we in the university, we spent some time in our internship in these centers, but as we don't have these centers, or the family physician can't refer the patients to there.
Yeah. One of the things I want to bring before we come to the end, and I do feel that's still being very important, is the mental health of the health professionals. How is going on with your own mental health to deal with or like as students? How is going? I do feel that in Brazil it's the end of semester, so what's going on with your own mental health, and how do you deal being in a rural area to survive and keep going and trying to do your best? Anyone wants to comment?
This semester, I started doing appointments with a psychologist because I was not good. I was feeling really tired, and I don't know. The university this semester was not so good to me, so I started doing this, but I have to pay to do these appointments. But something in that I think it's really good in my university is that a teacher, a psychiatrist, started doing appointment. He started doing these appointments to the medical students. Like every Wednesday in the morning, the residents and he do appointments that search for help for the mental health, but it's just the psychiatry appointments. They don't have access to psychologists doing therapies and like, but we have access to this kind of like treatment in our university. You can talk with this teacher and schedule an appointment. I think it's one step to increase the mental health for medical students, but it's not so good. Like this semester, one of my classmates tried to do a suicide attempt, and it was shocking for us.
Here we have also support for students in psychiatry because they found a really high rate of burnout syndrome in researching, but it is just like as Anna said, no therapy at all, just some therapy by psychiatry, but here we have for the students, not sure of this on the rural areas because I'm not there yet.
Chirag or Satak, do you want to comment?
Actually, we have a well-established department of psychiatry that is trying to address these kind of issues, but still we have had about 2 cases of suicide in the past 3 to 4 years in our campus. And some cases of depression are like very resistant kind. I have one of my batchmate who is suffering from depression from a very long time. He had it from his like pre-medical days, and he's on medicines for like 2 3 years since he has joined in the institute, but he's not getting cured. There are just ups and downs. Sometimes he feel little fine, but still it's kind of very resistant, and maybe some genetic association is also there because his father might has suffered from depression too. So these kind of things are there. And I would like to add that IFMSA and AMSA is would be going to have a joint campaign for the mental health in the medicine students. So we'll be starting that soon in July, I guess.
Well, actually, as Myra put it, the medical students are not given the tools in medical school itself. For example, I think in my internship, I just had 15 days posting in psychiatry, and we were mainly taught about diseases, but we were never talked about how to deal with them via therapy. We were just told about, yeah, you can give these medications and everything, but you're not taught therapy in medical school. So that is the thing which we have to start. And regarding the mental health of medical students, I think it's a point which is not much talked about, and generally not a lot of focus is given on them because generally people don't associate medical students with the with having problems in having mental problems, but that is actually not the case. And I think we should come more up in the open, and we should discuss these issues more openly. Then only we can address these issues within medical students, because a lot of medical students are facing these issues because of the huge study, as well as there's a very huge time period of medicine which students go through, and there's a lot of amount of stress involved in it, and there's a long time period before which you earn, which are all the cumulative factors which lead to mental health problems in students. So obviously we should deal with them, but as far as my college was concerned, we didn't have any tools, or there were no psychologists concerned that could help us in my medical school. And generally the problem in my medical school was more related to drug addiction, because my college was in a state where a drug addiction was a bigger problem. So a lot of my classmates and my seniors and juniors were addicted to drugs, and that was a bigger problem in my campus than mental health issue per se.
That sounds a huge mental issue, actually, being like a lot of drugs on the, because it's a reflection of the society and the way that we deal with that. And do you have any strategy in Rajasthan to deal with your own mental health, Sartak?
Unfortunately, we don't have in our medical school. We didn't have one, and if there was a case in the medical school, they would have to go to the general hospital. And but specifically for the medical students, there was nothing of any help.
Okay, so we need to go to the end. Yeah, we are coming to the end of our Rural Cafe. I just want to ask for the final comments. I just want, before I say bye, thank you all that participated. It was a wonderful Rural Cafe. And one of the things that I always love this project, and one of the things it's about my mental health to be in a Rural Cafe as well, because I can share a bit of what I'm experiencing and learning more about different perspectives. what I do to survive when I'm really stressed in my work, I do play drums on the end of the day, so I can put a little bit of everything out playing drums. And I love to also, I do some yoga, so I try to survive with this is my own supportive strategies to, or call to some friend, and to deal with my frustrations and to survive in the rural area. So that's what I'm trying to do now. And thank you so much. I just want to ask for final comments, maybe starting with Anna.
I really liked this rural cafe because I think it was really good to see two sides of mental health in Brazil and in India, and we have so similar things, but some difference, of course. And for me, participating in the rural cafes, it's like Mayara said, it's good for my mental health because I can share the things that I see and what I think, because sometimes in my university, as we don't discuss about rural health, just some of my friends understand what I want to say about this, and here I people can understand what I'm saying. So it was this. Thank you.
Shrag. Rag.
Yeah, so it was my first rural cafe, and it was a very nice idea. Uh, and maybe we were expecting a little more number of participation and from different backgrounds, obviously. So it was a nice one, and I'm looking forward to the next one and for a more huge response and different ideas coming up.
Thank you. Andressa.
Hey, it was really nice. And actually, I really like to know more about the the topic. How do you deal with this in India? And as Anna said, yeah, and it's all.
Sartak.
Well, I think it was a really nice topic for a rural cafe. And mental health, like finally we came to this topic, and it's a topic which you have a lot to share about it, but unfortunately it's the total reverse of it, that it's not much shared upon. So it was very good to get it in the open, and I think it was very good to get ideas from the other part of the world, from Brazil as well, to how to deal with it. For me, I think dealing with this, it's for my, like, my solution is to take a trip and leave everything behind. I don't know if it works or not, but I think it's like I have to leave this behind and try to move on, because I don't know if it's a very good successful tool to deal with it, because sometimes people say that you have to face the issue itself and not just move on. But I think every person have their different coping strategies and how to deal with it, and I think it should be left upon the person how they want to deal with it. So I think it was a very nice time to catch up with you guys and to learn about rural health and mental health in rural areas. So yep, I really enjoyed it. Thank you, Myra and Andressa.
Thank you all, and see you on the next Rural Cafe. We will have one in September, a special one in Africa. I hope everyone wants to can participate, and we keep going, and hopefully with more countries on the next one. But we keep talking. Bye.
Bye.